webinar to introduce you to the new features that are in version 8.9 of Home Health Gold Professional, which has been released. And if you don't have that installed yet, then you may want to approach your IT folks and see if you could get that process moving along. There are also the changes that are going to be in version 5.9 of Home Health Gold for those of you who have that program. That has not been released yet, but should be released in the next few days. So certainly no harm in knowing about what's coming a few days ahead of time. So that's why we went ahead with the webinar as it was scheduled and invited you folks to join us as well. As we go along today, if you have any questions, please go ahead and put those in the GoToMeeting or GoToWebinar panel on the right-hand side of your screen. And if we can't answer those during today's session, then we'll certainly get back to you later on today with a response. Those are saved by GoToWebinar, so we can capture those later. So hope everyone's doing well. Certainly, if you have any questions after today's session or feel as though you would benefit from a review session specifically looking at your agency's data, feel free to contact either Rhonda or myself, Rhonda, R-H-O-N-D-A, at homehealthgold.com, or Mike at homehealthgold.com. We'd be more than happy to connect with you. In version 8.9, the changes we made primarily, or in a large sense, were designed to try to introduce a little bit more normalcy throughout several places in the software. And I think that's going to make it much easier for you to take information that you see in one spot and keep that same concept in mind as you look at information in other spots in the software to really drill down and see where changes can be made in your agency. And that's also going to be true for our benchmarking that we'll be introducing, our external benchmarking. And I'll mention that again at the very end too to remind you about where we stand with all that. But let's start with the dashboard and the changes we've made there. We've grouped things differently. There's 80 some odd different measures, 86, 89, I can't count very well. But we've grouped them into some different categories. We had them grouped before, but we've just kind of refined these categories now. So you can choose the category that may be most interesting to you at the moment, and those cover a wide range of topics. And those are important, so kind of keep that in mind as we go along today. We'll take a look at them this way. By right-clicking, I can select a different measure and see the list of all 86 different measures. But these are the groups that we've placed them in now, the case mix measures, visits affecting payment, so things like LUPAs and upgrades and downgrades. A new category of hospital readmission and ER use, where we can see some graphs and trends for that type of information. Scores, HHRG scores, and functional deficit measures. So we've added some things here that we didn't have previously, episodes with minimal ambulation impairment and no ADL deficits, that sort of thought process where we can add a few graphs to capture how often that may be happening with your agency. Some therapy-related measures. The big change here, I think, is that we've historically always talked about F1s with 6 or more therapy visits expected. Because of some changes that CMS has made, it makes more sense to think of F1s that have 6 to 13 therapy visits expected. I won't get into all the details there, but if they have 14 or more therapy visits expected, the F1's not as great an indicator as it used to be. So we've fine-tuned that measure a little bit to look at those where the F1 is still potentially showing that you haven't shown many functional deficits. Payment and compliance issues, I don't think we've made any huge changes there, but again, just have grouped these a little bit differently. Agency volume and characteristics, service utilization. So I think these groups make much more sense to the way we think about managing agencies. And for the graphing purposes, the service utilization, we've broken it into two parts, into a group that looks at the average of how many visits you're averaging for discipline, for nursing or for PT or OT, and then a group that speaks to the proportion of episodes that have speech therapy or PT or social workers involved, and then a group related to just the breakdown by diagnosis, so you can see how many of your patients fall into each of the primary diagnostic groups. So again, just kind of wanted to initially point out the fact that we fine-tuned those groupings of those measures, deleted some that were no longer important, like the rebasing that we used to speak about. 2013 is kind of in the rearview mirror now, so we've been able to eliminate those, and that freed up some real estate to add some new good measures, I think, too. So also I've added a few things that historically have only been on the financial profile, things like expected payment, actual payment, episode cost. Those are all now available as dashboard graphs as well. So I think that you'll like all those changes. The other group that we've added is a group to help you prepare for PEPR. And I'm sure some of you, but maybe not all of you, are familiar with the PEPR reporting that CMS is going to start for home health agencies next month. PEPR essentially, I guess it stands for Program for Evaluating Payment Penalties Electronic Report. So it's something that's been around for other healthcare entities for quite a while, for nursing homes and hospitals and hospices. But home health is getting its turn as well. But there are things that measures about agencies that can be looked at to see which agencies maybe are being reimbursed in the highest level for certain measures. And these are the measures that that are specific to what they'll be reporting on. So this may be something that you want to keep your eye on to see if there's anything that really looks like you're way out of line of where others may be in regards to some of these LUPA measures or average case mix weight, things that again are indicative of possibly being on the extreme. Someone has to be on the extreme end of these, and those are the people that are going to get in the crosshairs of the PEPR report to see who's in the worst 10th percentile or 20th percentile. So we've had that type of information in Home Health Gold, so we were happy to be able to pull that together to give you a chance to study that about your agencies in a preemptive fashion. Another thing that we've done with our dashboard graphs, which I think will be well received and appreciated, is the ability to give you a little bit of text about why each measure may be important. If I could click on the right things here, we'll get back to where I started from. There we go. So if you right-click on any dashboard spot, you're familiar with the ability to select a different measure or change to a bar graph to a line graph. But we've added another layer here of how to use this measure. And this will show you how it's calculated, if you have any curiosities about what we're considering there, why it's an important measure, and what to take for recommended actions if you're not happy with your measure. So again, many of them are very obvious, but some of them may have a little bit of subtlety to them about why that is something that we report about and want you to take seriously. So if there's ever any thoughts or people who are new to home care that could benefit from some understanding about the bits and pieces of information that we try to manage and analyze, this may be a good resource for them to come to understand each of these measures. So again, just right-click and that'll be one of your options of how to use the measure. So again, keep in mind those groups that we had for a second. The other place that those are going to come into play significantly is now as we benchmark teams and providers in our side-by-side comparison. We've made some significant changes, improvements to this program as well. Takes a second to calculate, so I cheated and already did those ahead of time. So here are your options. You can compare, again, team to team or case manager to case manager. We've added the ability to compare in this same fashion, assessing clinicians to one another, and we'll take a peek at that, payers to one another, And if you have the telehealth module, you certainly can look at those that have telehealth versus those that don't have telehealth in comparison. But here's how things look now. So again, the same groups that we have on the dashboard, we've carried over to the side-by-side comparison. Will also be on our external benchmarking. So you can see case mix measures and PPS issues, visit levels affecting payment. I'll try not to make you nauseous by scrolling through all this too quickly. The hospital and readmission measures, how your HERG score and functional deficits, and so on, therapy-related measures. At the very end, we'll also have measures related to your outcomes. So I will make you nauseous for a second, so go ahead and look away. So here we could look at your outcomes. And that line needs to move over a little bit and start here. But you could see, again, team by team, who's outperforming whom in regards to each outcome measure as well. We've also installed the ability to sort these very easily. So here, the blue line would obviously be the average for all the teams. But if you click on the little drop-down arrow, you can sort by smallest to largest or largest to smallest, depending on whether you're optimist or pessimist, I guess. But our average case mix being that 1.06, we got there because we had teams underperforming that level, as well as teams exceeding that level. So for any of those measures, you can quickly sort that by that measure to see where's your average and who's above that and who's below that. So I think that's going to make the side-by-side piece much easier to use and much more effective than maybe what it has been in the past. So that's the comparing team to team here. And I also did a quick one with comparing assessing clinicians to one another. So again, very similar format. We have an awful lot of assessing clinicians. We have 148 assessing clinicians or something for our fictitious agency. But so it'll be the same format, same breakdown. There won't be as many measures here in the assessing clinician side-by-side piece because we wouldn't assign ownership to management things like LUPAs or outliers or outcomes to the assessing clinician. It would be more things that you would think about of what data comes from that assessment that's done. So it'll be a shorter list side to side here than what we're saw with the previous one, but it does still certainly cover a lot of ground and can give you some good insight about which clinicians are understanding OASIS as you hope they do, and maybe which ones are have some room for improvement, some room for training on those. So certainly with all this, let us know what you think. Let us know if you have ideas of something else we can improve, or if you like the direction we're headed, or just or what your thoughts may be. We appreciate the feedback. We still have the traditional assessing clinician statistics. If that's a report you're familiar with, we didn't change that. We just added the side-by-side ability to see them in relationship to one another. We have a question here, and I'll take a breath for a second. I think we covered it. If not, then we'll cover it a little bit later. So, so those are two of the big features: the changes to the dashboard, the side-by-side, and the third large area that we've tinkered with, hopefully improved, is the readmission measures or readmission reporting that we have. It's always been confusing to agencies, as well as to Rhonda and I, to teach you to, historically we had to set your dashboard back to be able to say, okay, from that point to today, we've had 30 days or more than 30 days, so we can measure whether we were able to keep people out of the hospital or not. So we're kind of measuring from the beginning of the episode. Well, we've changed things and simplified things, so you don't need to have that thought in mind now. Now it's going to say, okay, of the people that are discharged in the period we have our dashboard built for, which could be anything. Mine happens to be the first quarter of this year. But during that period of time, we've had people that have been transferred or discharged from our agency, and that's our pool, or that's our denominator. And then from there we can look at how long did we have them in care and those sorts of measures. So we simplified it, and you don't need to tinker with your dashboard at all. You can keep it set on just what you were thinking of, and we'll do the rearranging from there. So again, in Home Health Gold Professional, you'll have your referral sources here. In Home Health Gold, you won't have those options. And we're going to say at this point we have 504 transfers or discharges. I'll show you that at the top and at the bottom. These checkboxes are ways to fine-tune what you're looking for. And maybe you don't need to use any of those at all. Maybe you just want to know what happened with everybody, all 504 of those, and that's certainly fine. But as you select different exclusions, that number will change. So if I exclude patients if they weren't in the hospital in the preceding 14 days, well, I've dropped from the 504 down to 236 transfers or discharges. So that's going to be my remaining denominator. So every time you change something, it's going to affect who still fits. I look at these first two pieces as very similar. What you're saying is we'll only count them if they're fresh from the hospital, and we can determine that freshness, I guess, either based on M1000, if that's the way you'd like to do it, or by M1005. If you choose the M1005, you can toggle that up and down to whatever is really the right number for you. So a lot of latitude there. So I wouldn't encourage you to use both, because they will overlap and potentially be kind of confusing. But if you do want to use one or the other, they certainly both will accomplish the same sort of thing, just whichever way fits best with your thinking. Now we're down to 328 transfers if I set that in that manner. The other exclusion that I think you may use frequently is the ability to exclude people if the hospitalization reason was not scheduled. Exclude them if it was scheduled. So if we check that, it doesn't make a big difference here in our fictitious database here. It only makes about a 1% difference. It went from 504 down to 499. But you certainly can add that exclusion if you'd like. If you're attempting to mimic the claims-based readmission calculations, you can check this box, which will add all of the filters that CMS uses all at once. So that's why the indentation there. So if that's the direction you're headed, then certainly that will work just fine for that. We've added the new measures, relatively new measures for the total hips and COPD if you want to report specific to those people. And again, that's based on the inpatient diagnosis, M1010, as opposed to the ICD-9 diagnosis that you're using for your coding. Once we've made all those choices and decisions, our last decision is how we want to look at that distribution. Do we want to look at it by days in care or by referral source? So if we look at it by days in care, this will look familiar to you. So in day 1 of care, we had 4 readmissions. Again, we're using that whole batch of 504 transfers or discharges. And this is where the 30 days will come into play. So you could just follow this down to day 30 and say, okay, in 30 days, or within 30 days from that start of care or resumption of care, we had 61 out of those 504 people transferred to the hospital, which makes up 12%. And again, you can always drill down and see who these people are, which is important. And a nice thing that we've added here, just to prove that we do listen to what you ask for, and we understand it's important too, is how many visits have they had. So here, this person had quite a few visits, but here's a couple that only had a couple visits. And we had them in care for 17 days, but we only did 2 visits. Well, if we had been a little bit more involved or had other disciplines involved, would there have been the potential to prevent that rehospitalization? So you sort of can see how that factors into your results as well. Does your visit frequency have an impact on your rehospitalization rate? So that'll be a nice additional thought to be able to have there. You'll notice with this that it's going to go well beyond the 30 days or 60 days that you may be interested in. Here we're going to go back, almost a year, and that's okay. That makes sense. It's just saying that we've had someone in care for almost a year, and now finally they've had a transfer. That's not going to count against the hospital or a referral source. It's not going to reflect poorly on you. It's just happened, and that's why that goes up so high. Typically, I think you'll be looking at either the 30-day or 60-day mark to say, okay, how acutely did they go back into the hospital from the time we took care of them or assumed responsibility of them. The alternative way to look at the distribution is by referral source. So again, out of those 504 people who are transferred, we can think about them in regards to where did they start from. So we had 167 out of those 504 that started from Eastern Montana Medical Center or Eastern Maui maybe. And out of those, 41 went back into the hospital. What percentage is that? How many days in care were they? And again, with the ability to drill down and see who those people are. So these referral sources in Home Health Gold Professional will be coming right from your billing system, so you can see specifically those that you're most interested in, how successful are you at keeping them out of the hospital. So it's a change, so it makes us think again a little bit, but I think in the long run you're going to like it a lot better because you don't need to have faulty information showing up because you didn't set your dashboard back far enough or anything. We've eliminated that from you and put it on the software to worry about that stuff. So the other change that CMS has made is with their home health star reporting. And the way we've dealt with that is by adding a note to the measures that are included in that home health care star measurements or metrics. And we've done that simply by putting a little star next to the important measures or the measures that are used to compare you to one another. We can't show you how many stars you are earning because that would require us to have everyone in the world's data, and that's just not practical. But you certainly can see for yourself where you are for those measures and where you've been over time to see if there's anything there that you're not doing as well as you think you could, and possibly have some room for improvement there. This one, we need to shorten this title a little bit because it doesn't show very well. This is the other one that's part of the star report. So if you squish this line over a little bit, it is labeled as star, but it just doesn't show all that well yet. So we'll get that straightened out. Either make the screen wider or the words shorter. So I think those are the highlights of what we've added in this release. Again, I hope you like it. I hope that we're meeting your needs, and if it's helpful to have a review session or a little time with Rhonda or I, don't hesitate to ask. We'd be happy to help you out with these things or with anything else that you think you could use better if you understood it a little bit better. And just a reminder that if you click on Help and then View Online Help, that'll take you to our help page, and that's where you'll find our update notes about the changes in this most recent release. And then later on this week, we'll also have a recording of this webinar that will be here as well. If there's folks in your agency that couldn't join us today that could benefit from this information, you can direct them to the update, the online help page into the webinar, and that should answer their questions. Well, again, thanks very much. I'm going to peek at the questions one more time and see if there's anything here we need to address for everyone. If they're more individual agency-related questions, we'll just get back to them directly. And I think that's what I'll do is we'll just get back to them offline. So we can let you all get back to your regular jobs. Thank you very much, and let us know how you're doing and if you have any questions. Have a great day. Thank you. Bye-bye.